And we're back. You know, for the 15th year, an all-volunteer medical mission team traveled to Bolivia to save children who have congenital heart defects. The team spent 10 days there, more than 4,000 miles away, and they recently came back.
The team was made up of 30 people from across the nation, including 17 from the Houston area and 13 from Texas Children's Hospital. It's so awesome, right? As a Houstonian, you're like, really proud.
Right.
Two of the volunteers from Texas Children's join us this morning now, Dr. Saul Flores, and also April Navarez. They're both here with us this morning. Good morning. We're just talking to you guys. You're back at work now. Y'all returned last week. Yeah. Talk about this amazing trip.
Well, it was actually my second year participating. We went last year as well, and it was just amazing. It's, you know, everything that you hope it would be, giving back to a community that's underserved, and really fills the heart.
Yeah, it really does. It's actually my 5th year with the program, so it truly is a privilege to be able to bring technology, to be able to bring surgery to the kids with the most need. So the team is amazing. I get to work with some of the people that I work here down there and trying to help out kids that need the most.
How were they chosen, and how did you choose that specific area?
Yeah, so the way it worked out, it's being a collaboration that is a little longer than 5 years. I think it's been on for about 15 years. And now it's a well-oiled machine now. There's a very clear screening process. We partnered up with a local hospital, and there's a group of pediatric cardiologists that will screen the patients, not only for condition, but socioeconomic factors that may, you know, move them up on the list. Also, if they get sicker a little bit sooner rather than later, they'll move them up on the list. Obviously, the pandemic didn't help out because we had a pretty long backlog of patients that needed surgery, so we're trying to catch up now.
April, you guys did a lot of work in those 10 days. I mean, it seems like a lot of choreography. I mean, how did you pull off so many surgeries in such a short amount of time?
Well, it was a big team effort for sure. Me as part of the nursing staff, it was a lot of planning and preparation. So oftentimes everyone at work knew that I would go to this trip, and they're like, hey, we got a bag of supplies here. And so we would gather supplies throughout the whole year in the planning process, pack them, ship them, and then of course the medical team, you know, planning and the screening process that Saul just talked about. Lee, who is the director of respiratory services at Texas Children's, is a huge part of that as well, coordinating this trip. It's a big undertaking.
We're trying to picture this, like, how do you get, like, logistically 26 surgeries done?
10 days.
Is it one room that you're just constantly moving through? Do you have a big facility to work with? How does it happen?
So it's the local heart center in Santa Cruz, Bolivia. And the way it works out is, again, over time, these guys have been able to give us a very specific area where we can store the equipment. Not all of the equipment is transported, particularly, for instance, the cardiac pump stays there. But some of the stuff that goes with it has to be brought in. So day 1 of arrival, we set everything up. And then day 2 is when the surgery starts. So again, the team is now, it's a good, well-oiled machine that kind of works out.
You've done it enough to
We've done it enough times that we kind of know exactly how to move forward. And again, there's days that we can do 2 surgeries, there's days that we can do 3 surgeries, and simultaneously the cath lab is doing interventional procedures. So this is non-cardiac surgery through procedures in the groin that they can deploy devices and stuff like that. So sometimes they recover in the ICU, sometimes they recover in the step down. So,
gosh, just incredible. Talk about what inspires you guys to take part in this.
I mean, to me, like I said, really, I see medicine and health care as a service line, right? So it truly is a privilege to be able to serve, especially people that, you know, we deal with patients from newborns all the way to adults with heart disease from birth who require cardiac surgery or several procedures, and they oftentimes don't arrive to the hospital in the best possible shape. Right. So again, we train our entire professional career to be able to help those guys out. And, you know, being able to be part of a hospital like Texas Children's, Baylor College of Medicine, that truly gives us all the tools to be able to then partner with Heartgift and, you know, hang out with your besties down in the local country. It really is fun. Yeah.
April, tell us why you wanted to take part.
Yeah, even before I became a nurse, a really big part of me wanted to go to underserved areas. And so working at Texas Children's, which is the #1 heart center in the country. I feel very lucky and grateful for all the opportunities and resources that we have to learn about the heart and complex conditions. We've got great physicians that can educate, and so I felt really strongly to be able to go to a community that really needs those resources, the stuff that I've learned over my career.
Really be able to share that.
Exactly.
Is there one moment or one patient that sticks out to each of you?
Oh yeah, yeah.
I feel like each one of them,
Yeah, it's tough to
story.
it's really tough.
Every trip we have a survivor, right? Like someone who goes through something very challenging while we're there, or towards the tail end of the trip that we have to leave it on to the local team to take care of. So this year we had our little patient that, you know, she struggled at the very beginning of the trip, so it kept us all on our toes. And then, last night we were texting about her condition and her actually improving despite some of the complications that she had to deal with. You know, for obvious reasons, I'm not going to share her name, but the team knows exactly what I'm talking about.
So this was a beautiful text message then that you received.
Absolutely.
Had you guys kind of been on pins and needles waiting to hear since you left?
Yeah.
That must have been hard to
Eager
leave
for
in
sure.
that case.
Eager for sure. Yeah, it makes it really hard
Yeah.
to leave, but you know, the Bolivian team is wonderful and they keep in close contact with us, and that makes it really easy.
Yep.
And
Going back? Are y'all going back? When's the next trip?
Yeah.
We usually try to do it around Labor Day weekend.
Okay.
And Texas Children's has been wonderful about giving us that time and allowing us to go help the
you
community.
said this is your second year.
This is
right?
my
And
second
you're
year.
My fifth. Yeah.
Okay. Is there something special about going to Bolivia?
A tiny little
Tiny.
thing. So, as I share with you guys, I'm actually originally from Bolivia, and I have family out there. I get to hang out with. I stay a couple days after the trip to be able to hang out with family. So, but you know, not to mention that now, you know, folks running some of the units that we partner with are all classmates from med school.
Oh, wow.
So I get to do that as well.
A little
There's
reunion kind
A
of.
little reunion. You know, over the years we've been doing educational activities with the local ICU teams, and yeah, it's very fulfilling, as you can imagine. So.
Well, I just want to say thank you so much. It really is beautiful work what you guys do. Your entire life committed to serving others, truly. So thank you.
I appreciate it.
Thank you.
Yeah,
Thank you.
Dr. Saul Flores and April Narvaez, both from Texas Children's Hospital. Appreciate it.